Prostate cancer is the most common cancer in men in the UK. Every hour, one man dies from the condition.
There's probably about 30,000 new diagnoses per year. And in terms of mortality, probably 10 to 12,000 men a year die from prostate cancer. And it's analogous to breast cancer. In other words, the same numbers of women get breast cancer as men getting prostate cancer.
The risks of developing prostate cancer increase with age and if you have a family history of the condition. Those of African and African Caribbean origin are also at a greater risk.
001.
There are no specific symptoms in the early stages of prostate cancer. If urinary symptoms are present, the most likely cause is an enlargement of the prostate. However, prostate cancer needs to be excluded.
Because of the position of the prostate sitting underneath the bladder, can affect the way a man passes his urine. And the kind of problems a man might notice is difficulty in getting started to pass his flow. The stream can be slow, he can be going often, he may have to get up at night a few times. He may find that it takes him a long time to actually expel the urine from his bladder. He may find that actually it's not emptying the bladder properly, so a few minutes later it's got to go back.
Urologists would advocate that men over the age of 50 need to have regular checkups regardless of whether they have symptoms or not.
This would be the rectum, and this would go in like this.
Diagnosis of prostate cancer is made by a PSA blood test, rectal examination and a prostate biopsy.
PSA, which stands for prostate-specific antigen. This is a chemical made by the prostate gland, and in prostate cancer the level of this chemical tends to be higher than normal. And if the PSA is raised, even without any symptoms whatsoever, that's an indication for referral to a urologist.
55-year-old Rawl Price considers himself to be very lucky. He was diagnosed with prostate cancer in 2003, despite showing no obvious symptoms.
I just suddenly didn't feel right. And I went to the doctor to generally find out what was wrong with me because I kept feeling tired unusually.
He didn't have any specific urinary symptoms at all, but he had his PSA checked with lots of other things he was having checked because he felt a bit under the weather, and it turned out that despite his relatively young age, he did have prostate cancer. And he's had that dealt with, and 5 years later, there's been no sign of recurrence.
I've been given the all clear now, but I still have to have follow-up clinical appointments on a yearly basis. Started off at 3 months and it went to 6 months. Now I could just go to my GP and they'll do the PSA tests, which is a yearly thing.
Once a diagnosis of prostate cancer is made, further tests are needed to decide upon the best course of treatment.
For example, we may get a CT scan or an MRI scan or X-rays of trying to determine if the cancer is spread beyond the prostate gland. At times we might do what's called a bone scan to determine if there's any prostate cancer spread to the bones. Either it's localized or it's metastasized. If it's localized, that's when we have a whole array of treatments that we can do with the aim of trying to eradicate the cancer altogether. Surgery is just one option.
One alternative to surgery, which is proving to be very effective in treating prostate cancer, is brachytherapy.
Brachytherapy is an advanced and sophisticated technique. It's a sophisticated way of dealing with a localized prostate cancer. Brachytherapy is a technique that I have particular expertise in. I've been trained both at centres in the UK and also in Seattle, where brachytherapy was first popularised. This works using radiation to destroy the cancer. And the way we deliver radiation to the prostate is we implant these tiny little pellets, about the size of a grain of rice, into the prostate gland, where they stay permanently, and they give off their radiation over a very short distance, and that destroys the cancer. And the great beauty of this is that it's done as a day case. It does require some sort of anesthesia, either a general anesthetic or what we call a spinal anesthetic, where the lower half of the body is put to sleep. And it's a treatment that the men tolerate very well. So I'm very keen on this way of dealing with prostate cancer.
Any side effects from this treatment tend to be urinary difficulties. These, however, don't last long and can be counteracted with tablets.
What we found is that when we've given men the option of a radical treatment for their prostate cancer, and we've told them about brachytherapy, the vast majority of men opts for that as a treatment. And to date, all the men at our centre that have had brachytherapy have done very well. And of course, any cancer has a risk of recurrence. I mean, it's a small risk in prostate cancer, but nonetheless, we follow these men up for many years, minimum of 10 years, before we can say, you're cured.